Hi everyone. Today we have Dr. Sarah Easaw who will be talking to us about skin cancer prevention and detection. Dr. Easaw is a board certified hematology and oncology specialist practicing in Ocean Hematology and Oncology, Lakewood, New Jersey. Let us learn about skin cancer prevention and detection. So, Dr. Easaw, please tell us what are the most common forms of skin cancer?
Skin cancer can be mainly divided into two groups, melanoma and non-melanoma. Non-melanoma can be either basal cell cancer or squamous cell cancer. Basal cell carcinoma is the most common form of skin cancer and it's found in the basal cells of the skin. Basal cell carcinoma is usually found primarily in the areas of the skin that get the most exposure to sunlight, such as the face, head, hands, and neck. It's mainly common in fair skin people and is very rarely seen in people with darker skin. Squamous cell carcinoma is the second most common form of skin cancer and it is found in the outer layer of the skin in areas most exposed to the sunlight. Ultraviolet radiation in the sunlight is the main environmental carcinogen that causes squamous cell carcinoma of the skin. Cumulative sun exposure, principally ultraviolet B radiation, is what causes squamous cell cancer. In contrast, intense intermittent sun exposure, such as sunburn or childhood exposure, is the most important risk factor for basal cell carcinoma and melanoma. Melanoma develops in the cells that are responsible for making pigment in the skin, and it is the most dangerous type of skin cancer. It is quick growing and it's capable of spreading through the lymph nodes and through the blood to the internal organs. If found early enough, it can be treated with a high treatment success rate.
What are the skin cancer warning signs?
Each type of skin cancer has specific symptoms to watch for, but overall, it's important to be aware of your body and to take note of any noticeable changes to your skin, regardless of whether it fits into one type of the specific symptoms that we discuss here. Basal cell carcinoma can look like scars, lumps, or nodules that are shiny or have visible blood vessels, crusty, itchy patches of skin that may bleed or have a depression in the middle, or red patches of skin that looks like eczema. Squamous cell carcinoma can look like any sore that does not heal or comes back after healing. It can look like a rough feeling growth or bump that get crusted and bleed. Melanoma, on the other hand, can present as moles or scaly patches of skin, open sores, raised bumps, or black marks under the finger or toenails. We can use a mnemonic A, B, C, D, E to memorize the warning signs of melanoma of the skin. Any change that can occur in a regular mole in the following order: A for asymmetry, irregular borders; B, C, the change in color; D, diameter, the change in size; E, evolution, that means the change in the size of the mole or change in the shape of the mole. Any of these changes can be a warning sign that a mole may be changing into a melanoma or a cancer of the skin.
What are the treatments for skin cancer?
Both melanoma and non-melanoma skin cancers can be treated and cured if it is caught early. Surgery is the mainstay of treatment for skin cancer, and if detected early, there is a high rate of success for treatments. The main objective is to remove all the cancerous cells, which and include a margin of non-cancerous cells around the cancer. The type of surgical removal will be depending on the size, the depth, and location of the tumor, and also whether it's a melanomatous or non-melanomatous cancer. Usually done as an outpatient basis, and there is no overnight hospital stay required.
What are the tips for skin cancer prevention?
Preventing skin cancer is mainly by minimizing the ultraviolet light exposure by limiting the time spent in the sun in peak hours, using sunscreen and also wearing protective clothing. These are the most effective way of primary prevention strategy for skin cancers. UV light is a risk factor for melanoma, so reducing exposure to UV light from sunbathing and indoor tanning, and also increasing the use of sun protection is a way of reducing the incidence of melanoma. Shade structures, sun protective clothing, sunscreen, and other measures can provide sun protection. People who are at risk of getting melanoma and people who are at highly exposed to sunlight should apply a broad spectrum sunscreen with a sun protection factor or SPF of 15 or higher daily and thoroughly before going out during daylight hours. You should look for a sunscreen that is labeled as broad spectrum, meaning it protects against both UVA and UVB rays. And applying the sunscreen twice a day is a good way to achieve better protection. Most healthcare providers and the American Society of American Academy of Dermatology recommend that you should use a sunscreen with an SPF of 30 to 50 on exposed skin. And also you should use a sunscreen that protects against both UVA and UVB radiation. And good application is needed to achieve that labeled SPF. One approach is the teaspoon rule, which means a generous teaspoon of sunscreen should be applied to each leg, the front, the back torso, and a generous half teaspoon to each arm, face, and neck. You should reapply the sunscreen after sweating, rubbing the skin, drying off with a towel, or swimming. And it's also advisable to reapply the sunscreen every 2 to 3 hours as long as you're outside in the sun. If you take these careful measures and watch for symptoms and signs of skin cancer and go for early checkup and to note any changes in your skin cancer can be prevented and treated very properly.
Thank you, Dr. Easaw. It was great that we were able to spread awareness, and I hope that everyone shall follow your tips of prevention. Thank you.